Did you know that high blood pressure could be beneficial in some types of stroke? In this discussion, let's look at how to treat stroke. So throughout the discussion, let's look at the types of stroke, treatment of ischemic stroke, treatment of hemorrhagic stroke, and finally let's look at the long-term management of stroke patients. So what are the types of stroke? Most commonly we have ischemic strokes. In an ischemic stroke there is blockage of the blood vessels, thus it decreases the oxygen supply. Etiology for ischemia could be either thrombotic or embolic. In thrombotic, there is formation of a clot within a vessel in the brain. Embolic type of stroke occurs when a blood clot from another part of the body dislodges and travels to the brain. The origin of embolic stroke could be the heart, for example, in patients with atrial fibrillation. In this condition, the upper chambers of the heart are beating in a non-rhythmic fashion. Thus, there can be formation of clot within the left atrium. And if this clot dislodges and travels, it could go to the brain and cause an embolic type of ischemic stroke. Sometimes the heart valves can predispose to the formation of clots, and these clots can travel to the brain as well. Another location for the formation of embolic stroke is the carotid arteries. Carotid arteries are the arteries in the neck. When there is plaque formation within the carotid arteries, they can dislodge and travel to the brain, causing a stroke. Around 20% of the strokes are hemorrhagic. In hemorrhagic strokes, there is bleeding into the brain, and these can be further divided into intracerebral or subarachnoid hemorrhage. Intracerebral hemorrhage is a true brain bleed. It is like bleeding into the brain, and it can occur due to very high blood pressure, maybe trauma. Some people have weakening of the blood vessels, and these are called aneurysms. And sometimes there are congenital malformations which predispose to the rupture of the vessels, and also some bleeding disorders such as hemophilias. Subarachnoid space is the space between the brain and the lining of the brain, and there can be bleeding into the subarachnoid space, causing subarachnoid hemorrhage. Most common complaint is headache, and people explain this headache as the worst headache of my life. Alright, now let's look at the treatment of ischemic stroke. In ischemic stroke, there is blockage of the blood vessels, blocking the blood supply to the brain. So now we want to restore the blood supply, and it must be done ASAP. So time is highly crucial because it determines the treatment. As soon as a patient suspected of a stroke comes to the ER, it is crucial to perform a non-contrast CT. This helps to identify blood. If there is presence of blood, it means this is a hemorrhagic stroke. If there's no blood, it is a ischemic stroke. Once we are certain that there is no blood and have identified it as an ischemic stroke, we can determine the treatment. So the main treatment option is the thrombolytics. As the name suggests, it's going to lyse the thrombus. However, it is going to lyse every thrombus in the body, so we must determine it is ischemic before administering thrombolytics. So the thrombolytics are the TPA. It stands for Tissue Plasminogen Activator. It comes under the brand name of Alteplase. The newer drugs are coming under the name of Tenecteplase, and this is given under the intravenous route, and 10% of the total dose is given as a bolus, while the 90% of the total dose is given over the next 60 minutes. However, the time administered thrombolytics is crucial. It is only given if the time of symptom onset is less than 4.5 hours for non-diabetic patients, and if it is less than 3 hours for diabetic patients. And the door to needle time. It is the time of arrival of the patient to the ER up to giving the medication. It should be less than 1 hour. So it is critical to do the appropriate testing and determine if thrombolytics can be given. So what are the contraindications to giving thrombolytics? Any type of head trauma, cancer, INR of more than 1.7, or low platelets. If a patient was given heparin within 2 days, any GI bleed, surgery within about 2 weeks are some of the contraindications. So you understand that there are lots of factors to consider if a thrombolytic is to be given. Side effects of thrombolytics can be fatal because it can lead to hemorrhage. The next type of treatment is mechanical thrombectomy. It is done via a catheter to remove the clot with a stent retriever device. Unlike thrombolytics, this could be beneficial up to 24 hours of symptom onset, and this could be done with or without thrombolytics. The other treatment option is the use of aspirin. Aspirin 325 milligrams can be given for patients who have contraindications to thrombolytic therapy. For patients who cannot tolerate aspirin, clopidogrel or dipyridamole can be given. Now let's look at the treatment of hemorrhagic type of stroke. This could be either medical treatment or surgical treatment. Before medical treatment of a hemorrhagic stroke, it is crucial to identify the cause. The cause could be very high blood pressure. It could be trauma, any malformations, or some medications such as anticoagulants. The next step is controlling the blood pressure. So the target for mean arterial pressure is less than 110 millimeters of mercury. Then the other crucial step would be to stop any medication that would increase bleeding. Medications that could increase bleeding are warfarin, other novel anticoagulants, or antiplatelets like aspirin. Another crucial step in hemorrhagic stroke is controlling pressure in the brain. To measure the pressure within the brain, we can use a ventriculostomy tube. This helps to both measure the pressure and also to drain the fluid within the brain, or if there's any hemorrhage, to drain that as well. Because if there is higher pressure within the brain, there is a risk of herniation. This is life-threatening because when the brain herniates, it can press the respiratory centers and it can lead to death. Surgical treatment can be done to treat an aneurysm. For that, a clamp could be used or a coil could be used. Coil is an endovascular procedure which is less invasive. Surgery can be the treatment option for AV malformation. AV stands for arteriovenous malformation. Surgery, radiation, or embolization can be used to fix the AV malformation. Lastly, surgical treatment option for a hemorrhagic stroke can be craniotomy, and this is done to decrease the pressure and decompress the brain. And these are the surgical treatment options for hemorrhagic stroke. Okay, now we will look at how the blood pressure is managed during acute stroke. Of course, in the long term, using antihypertensive medication is beneficial to prevent a stroke. But during the initial stages of stroke, this may not be true. So during the initial stages of stroke, blood pressure goals are dependent on the type of the stroke. If the type of stroke is ischemic and tissue plasminogen activator is given to the patient, the blood pressure must not be too high because it can increase bleeding. However, if the TPA is not given, blood pressure can be a little bit higher, and that may be okay. This high blood pressure can be beneficial because it can help to bring blood to the area around the stroke. But this is not the case for a hemorrhagic stroke. The blood pressure must be maintained at a low stage because the hemorrhagic stroke can be occurring due to high blood pressure. Now let's look at the long-term management of stroke. It involves prevention of another stroke, and this is called secondary prevention. So to manage a stroke patient in the long term, we need medications. And these medications help to reduce the risks. Decreasing risks involve controlling blood pressure and then decreasing cholesterol and prevent formation of clots. To control blood pressure, lifestyle modification as well as medications can be helpful. To decrease the cholesterol, statin medications can be given. And to prevent clots, aspirin or other antiplatelet medications can be given. And some patients might require anticoagulation. And for that, warfarin or new anticoagulant medications can be used. The other important step in the long-term management stroke is the management of complications. After a stroke, patients might have eating difficulties. So they may have dysphagia, and that may even contribute to malnutrition. Patients can get urinary tract infections, heart diseases, bed sores, and may even get depression. Due to this, stroke patients must be managed by a multidisciplinary team. So to conclude, the treatment of stroke is dependent upon the type of stroke, and thrombolytics are very important, however they are time sensitive. List of contraindications for the use of thrombolytics is quite long, so it must be used very cautiously because of the risk of hemorrhage. For patients who do not qualify for thrombolytics, mechanical thrombectomy can be used. Treatment of hemorrhagic stroke is different from ischemic stroke because it pays much attention to controlling the blood pressure along with attention to certain medications and controlling the pressure within the brain. Long-term management of stroke involves multidisciplinary team with many experts, and that summarizes treatment of stroke.